Hello everybody, welcome back to the channel. Today we are not talking about homophobia. I did say that in the last video, but a different topic has... What's with the lighting situation? I don't know, we'll have to deal with it. But another topic has come to my attention. Something Joe Biden, the President of the United States, is not focusing on, which is, in my opinion, the biggest problem as of right now, considering the most deaths are caused by drug overdoses and suicide. YouTube, please don't block my video for saying those two words. I'll say OD from now on, because YouTube's less likely to block the video if I say OD. But anyway, let's get into some information. Let's look on the internet. We're also going to be talking about uses of marijuana and such. First of all, I'm going to start talking about what I believe in the drug epidemic and such. Doctors are the biggest drug dealers. If you're a doctor, this is not offense to you. I'm talking about specific doctors. Some doctors try to get people hooked on drugs, say they have something, which they don't, and get them hooked on drugs and stuff. Antidepressants, I'm not saying depression. A lot of people don't have depression. I'm talking about antidepressants is not the cure. I'm sure of it. I'm not getting into that in this video, but antidepressants, doctors give to people, get them hooked on painkillers. This is what I think. This is what I think. We're going to look at some evidence on the internet. I mean, some of it we may not be true, but we're going to look at. Like I said, antidepressants, Xanax. My mind just left. Painkillers, steroids, such stuff like that. People get hooked on it and are potentially likely to OD from it, and they also spend a lot of money on it, and it makes them go broke, breaks them up and stuff. I think Tom McDonald may have got hooked on antidepressants or something. Xanax, I think he got hooked on Xanax too. Let's look at a little about Xanax. Let's look. Oh, okay, so I did not actually know what I thought about Xanax. May treat anxiety with depression, generalized anxiety disorder, anxiety and panic disorder. May treat drug class and anti-anxiety agent benzodiazepines. In my opinion, I would say depression such as is cured by therapy and such, and you never really get over it. But you have a good support system, have friends, people check up on you and stuff, and go to therapy. But drugs are not always the answer. If you look at the situation in LA, a lot of people are homeless, living on the streets because of drugs. So we're going to be looking at more of the popular drugs, the doctor drugs first of all. Then we'll look at the illegal drugs and such. Like I said, I do not believe marijuana should be illegal. Definitely not for medical use. If it will, we'll look at what it will cure in the medical field, and it really shouldn't be illegal in civilian use either, considering the fact that it has no, there is there is not really any way for anyone OD from it, but we'll look up on it and see. And here's something it says here: do not take while breastfeeding or when pregnant. This is one main problem. My mom pointed this out. Women tend to take drugs and alcohol. This is about alcohol too. I forgot about that. We might actually have to do a part 2 about this. But pregnant women drink alcohol and stuff. Well, actually, we'll get into that later. Right now, we're talking about drugs and Xanax. Avoid alcohol, other drugs that make you sleepy. Measure dose usage. Using a dosing dropper. Do not chew or crush. Okay, split tablet if scored. Peel open with dry hands and place tablet on tongue. May make you drowsy or dizzy. Drive with caution. Call doctor if medicine doesn't seem to work. Call doctor before increasing dose or frequency. May be habit forming. Xanax is a generic name, blah. But anyway, may be habit forming. This is a problem with drugs. Anxiety and depression does not need to be cured with drugs. That's the problem with the world today. There are too much drugs, and a lot of people are ODing. Let's actually Google number one cause of death. I believe it's either drugs or suicide. One or the other. Number one cause of death: heart disease and cancer. Okay. 5 leading causes of death. Never mind. Heart disease, cancer. Okay. Drugs is up there, though. We'll talk about my thoughts on cancer, too. Coronavirus ain't even one of the leading causes of death. We'll get to the end of that in another video. I have a lot to say about coronavirus. CV, we'll call it that, because YouTube does not like me saying that word. Thank you, YouTube, for your wonderful rules. Sarcasm, obviously. Let's look at, let's look at, what should we look at next? Painkillers. Let's look at painkillers next. Drug. Not movie. I didn't even know there was a movie. Non-steroidal anti-inflammatory drugs and NSAIDs. Examples of NSAIDs include ibuprofen, diclofenac, and naproxen. Aspirin also. Weak opioids and strong opioids. Strongest to weakest. So there's a lot of painkillers, actually. Codeine. I did not know codeine was a drug. I thought it was alcohol. I hear it in rap music a lot. Ibuprofen. Ibuprofen's not that strong, obviously. Considered as habit forming or addicting. The fact behind is these drugs an individual feel unhealthy for a short time duration when stop taking it. Stupid ads. If for any certain fact this drug is consumed for a longer period, then consult your basic doctor for suggestions. Okay, codeine is a problem. It looks like codeine's a problem. Morphine is a problem too, I would say. Doctors tend to sell patients codeine and morphine when they do not need it, therefore getting them hooked. there are a lot of drugs, it looks like. Look at this list of drugs. Just look at it. This is what our doctors are giving people. We need to do some serious things about this. These addictive drugs that really don't work do not need to be sold. If codeine does work and stuff like that does work, it should be monitored. These doctors should be monitored. In my opinion, doctors are #1 drug dealers. No offense to any doctors watching this. I'm not talking about every doctor. I'm talking about specific doctors. Doctors who actually do this type of stuff. This is real. We don't need to be ignoring this. This is a big deal. And Joe Biden's the president. He needs to be focusing on this. I know he won't. Well, I'm going off the wall here. He ain't in charge of the country. Bernie Sanders and or Nancy Pelosi or someone like that. Hate it or I don't really care what you think of that, but we're not talking about that. Okay? Okay, actually let's look up marijuana next. Is marijuana the same as weed? Other common names: weed, pot, herb, bud, dope, spiff. Yeah, it is. I've only really heard weed, pot, and dope. But anyway, what states made marijuana legal? Alaska, California, of course California. Of course California. But it should be allowed, I think. Oregon, Massachusetts, Maine, Nevada, and Washington. The sale and possession of cannabis is legal for both medical and recreational use. And Washington, D.C. has legalized personal use but not commercial sale. Yeah, I think personal use of marijuana should be legal. But actually, I don't think it should have commercial sale, actually. Probably shouldn't have a commercial sale or something, but all 50 states should have marijuana legalized. Let's look at effects, uses, and, well, we know legalization. We just looked at that. What is marijuana? Marijuana's cannabis is a green, brown, or gray mixture of dried, shredded leaves, stems, seeds, and flowers of the hemp plant Cannabis sativa. Marijuana is used as a psychoactive recreational drug for certain medical ailments and for religious and spiritual purposes. Sinsemilla hash, I can't pronounce these words, and hash oil, sticky black liquid are strong forms of marijuana. Well, maybe shouldn't have stronger forms. But I don't really know. We'll have to look about this. According to the National Institute on Drug Abuse, marijuana is the most abused drug in the U.S. Many states in the U.S. have now legalized marijuana from. Okay, that just turned 360 degrees. However, according to federal law, possession of marijuana cannabis is still illegal in the U.S. except within approved research settings. That also ain't true because we just read that was legalized for personal use in certain states. How does marijuana work? I don't really want to read all this, but I guess we have to. Let me make sure. Let's see the time. 15 minutes, so okay. Main active chemical in marijuana is the THC, delta-9, blah blah. The psychoactive ingredient. The highest concentrations of THC are found in the dried flowers or buds. When marijuana smoke is inhaled, THC rapidly passes from lungs into the bloodstream and is carried to the brain and other organs throughout the body. THC from marijuana acts on specific receptors in the brain called cannabinoid receptors, started off a chain of cellular reactions that finally lead to a euphoria or high that uses experience, feeling of a relaxed state, euphoria, and an enhanced sensory perception may occur. Okay, we know it makes it high. Proved in investigational products. Extent of marijuana use. 2019 has found that vaping and marijuana on the rise among teens. However, the survey continues to find declines in prescription opioid misuse, tobacco, cigarettes, and alcohol. In the past survey year, over 43 million people aged 12 and over reported using marijuana. In the same survey, past year marijuana use among adolescents aged 12 to 17 years was over 3 million in 2018. Overall, marijuana was the highest amongst the group to 18 and 25-year-olds of age at 34%. It's not that big of a deal. This is not a serious drug as a lot of these. They're acting like marijuana is the most serious. The short-term effects of marijuana or cannabinoid use include increased heart rate. Well, that's what you get when you have energy drinks. Low blood pressure, orthostatic hypotension, muscle relaxation, slow digestion, dizziness. Well, what do you get when you what do you get when you drink? You get hungover the next morning. Distorted perception, sight, sounds, time, touch. Marijuana should not be used while driving. I'm against that. Difficulty in thinking, memory, and problem solving. Loss of coordination and motor skills. Like I said, shouldn't smoke it and drive. Agitation, anxiety, confusion, panic, paranoia. Not very good, but it's short term. Increased appetite, dry mouth, and dry eyes. These are not that big of a deal. Withdrawal symptoms can occur upon abrupt cessation of the drug, including anxiety, agitation, tremulousness, elevation of vital signs, insomnia, irritability. You use it responsibly. Effects on the lungs. After smoking marijuana, biochemical passage relaxes and becomes enlarged. Marijuana smoke contains many of the same cancer-causing materials found in cigarette smoke, often in greater quantities. Both types of smoke contain cancer-causing nitrosamines, phthalate, aromatic hydrocarbons, vinyl, chlorines, and phenol. So, well, any drug during pregnancy and breastfeeding. I'm not using the feminist term or the other term of chest feeding. I'm calling it breastfeeding because that's what it is. We'll talk about this LGBT and homophobia. I'm not against the movement, but there are some messed up things in it. But yeah, so that's marijuana. It's not as big of a deal as it's not as big as a deal as although the condition varies from state to state. Top medical conditions for which patients might use medical marijuana include cancer, glaucoma, HIV and AIDS, persistent muscle spasms. This cures cancer, glaucoma, HIV, AIDS, muscle spasms, multiple sclerosis, seizures, severe pain, severe nausea, or dramatic weight loss, and muscle wasting syndrome. Okay, I'm gonna pause this. I'll be back. Alright, I'm back. We got about 10 more minutes until I have to end this video. Let's actually look at some of the problem what we got with let's look at some more about Xanax, because we don't look well. No, we looked at the we looked at precautions, didn't we? Yeah. Habit forming. Let's look at codeine. I didn't spell it right, but pain medication, sometimes called a narcotic. Codeine is used to treat mild to moderately severe pain. You can't have any of this and take codeine, basically. Noisy breathing, sighing, shallow breathing, breathing that stops during sleep, a slow heart rate or weak pulse, a lightheaded feeling like you might pass out, confusion, agitation, hallucination, unusual thoughts of behavior, feeling of extreme happiness or sadness, seizure, problems with urination or low cholesterol levels, nausea, vomiting, lost appetite, dizziness, worsening tiredness, or weakness. Alright, we see the I wouldn't recommend codeine. Alright, we're going to end this video a little short, but just remember that what I said, drugs is a serious problem in this country, and I'll do one on alcohol, because I did really talk about alcohol. I don't know how to set more than 30 minutes. I know that button you can raise up the time, but you can only raise it up a certain amount, so I don't know. But thank you all for watching. If you enjoyed, make sure you hit that like button, subscribe to the channel, turn post notifications to get notified when I post my next video. Please, no hate comments. This is my opinion. I'm allowed to have my opinion. Wow, maybe I shouldn't have done that. I did it full screen. But, yeah, this is my opinion. And they're going, and, yeah, so, see you in the next one, and peace. Peace among y'all. No hate on anyone, on any doctors or anything. I don't want no hate. This is not a channel about hate. This is a channel about telling the truth. A news channel, if you want to call it. And bye.